Good afternoon, everyone. Welcome to the Virtual Urban Institute. My name is Mary Cunningham, and I am the Vice President of the Metropolitan Housing Community Center here at Urban. Our team of researchers here at Urban has been honored to serve as the evaluator of the Denver Supportive Housing Social Impact Bond Initiative. And I'm excited to moderate our event today to release and discuss the results of this remarkably successful initiative. Before we start, some quick housekeeping as always. This event is being recorded and the recording will be posted online afterward. Speaker biographies are available online at urban.org and a link to bios will be posted in the chat. We have closed captions turned on. If you'd like to adjust your settings, click the live transcription button at the bottom. All participants are muted, but you can send questions or comments in the Q&A box at any time, and we hope to have enough time today for audience Q&A. If you're on Twitter, please join us in tweeting about the event using the hashtag #LiveAtUrban. And finally, I'll remind you again, but please take a minute to complete the event survey that will be shared at the end of the event. So with that, I would like to introduce Mayor Michael B. Hancock. Unfortunately, the mayor had unexpected travel today to DC. A small group of mayors and governors were meeting yesterday with President Biden and VP Harris to talk about infrastructure, including investments in affordable housing. But we have some recorded remarks from the mayor. So I'm going to introduce him and then we will play those recorded remarks. So Mayor Hancock is Denver's 45th mayor, the second African-American to hold the position, and a Denver native. Mayor Hancock has dedicated his life's work to serving the people of the Mile High City and sees one of his most important jobs as bringing opportunities to the city's underserved communities, especially communities of color. It is his firm belief that people who live in the city's traditionally underserved neighborhoods deserve the same opportunities that so many others in the city have. With an equity-focused approach, the mayor initiated record dedicated investments in affordable housing and tripled funding to support those experiencing homelessness. With the onset of COVID-19, while the city's department budgets were shrinking, the mayor's administration deliberately increased funding for safety net departments. And to date, his administration has dedicated more than $110 million in Federal CARES Act and FEMA dollars towards serving and supporting people experiencing homelessness during the pandemic, as well as identifying and securing much needed hotel rooms and creating 2 24-hour shelters equipped that go beyond traditional shelter to also provide COVID-19 testing and other supportive services. One of the first, most consistent and strongest champions of the Denver Supportive Housing Social Impact Bond, I'm pleased to introduce Mayor Michael B. Hancock. He's going to provide some recorded remarks, and then we're going to hear some personal stories from some of the program participants.
Good afternoon. I'm Mayor Michael Hancock, and I want to thank you for joining us to hear the outcome of Denver's first Supportive Housing Social Impact Bond Initiative, or the Denver SIB. This project took the dedication and commitment of numerous public and private partners, including our independent program evaluators and the host of today's event, the Urban Institute. Local evaluation support from the University of Colorado, Denver, and the Center for Housing and Homelessness Research at the University of Denver, the Corporation for Supportive Housing, Enterprise Community Partners, Colorado Coalition for the Homeless, Mental Health Center of Denver, Social Impact Solutions, and Colorado Access. I also want to thank the many private investors and statewide government and nonprofit partners, many of whom are joining us here today and without whom this would not have been possible. You know, 7 years ago in June 2014 at the Clinton Global Initiative in Denver, I announced one of the first city-led social impact bond programs in the country with a focus on addressing the challenges of chronic homelessness. At the time, Denver was among the many cities whose jails and emergency rooms had become the most expensive housing and mental health care centers for people experiencing chronic homelessness. Our goal with the Denver SIB was to leverage the private investment to house hundreds of people experiencing chronic homelessness and to connect them to intensive services and case management in order to reduce their interactions with costly emergency care and jail systems. A study by the Denver Crime Prevention and Control Commission looked at 4 years of data from 250 residents experiencing chronic homelessness who also experienced frequent mental or behavioral health crises. It found these residents spent more than 14,000 nights in jail and visited behavioral health detox facilities more than 2,000 times a year. It cost the city about $11 million a year to serve these 300 residents through the emergency care and jail systems, which were not designed to address their long-term needs. And there was the mental and physical toll, a cycle of living on the streets, going to emergency care or jail and back to the streets was taking on these residents. We needed to do something different. So we worked with industry experts to develop a Pay for Success initiative that leveraged $8.6 million in upfront financing from private investors to provide the capital needed to deliver supportive housing to 325 people. We committed to repay the investors if the initiative achieved its goals of helping participants maintain housing and reduce their interactions with the criminal justice and emergency care systems. In January 2016, we housed our first residents in supportive housing units across the city. Over the next 5 years, this team of independent evaluators conducted one of the most rigorous assessments of how supportive housing affects people's interactions with the criminal justice system and the emergency health services. Now, I'm pleased to say today, their evaluation shows the program is a remarkable success. Here's what we learned. When people experiencing chronic homelessness were offered housing, most took it and stayed in for long term. 77% of those housed through the program remain in stable housing. The Denver SIB significantly increased participants' access to housing assistance, and it reduced their use of shelters by as much as 40%. The Denver SIB participants interacted with the criminal justice system less often when compared to people who receive usual services in the community. Denver SIB participants had 34% fewer police contacts and 40% fewer arrests. Participants also went to and spent significant less time in jail. Those in supportive housing went to jail 30% less often, and when they did experience incarceration, their total jail days were 27% less than their counterparts. When it came to health outcomes, people in supportive housing visited emergency care 40% less often. They increased their use of office-based health care by an astounding 155%. And they reduced their use of short-term, city-funded detoxification facilities by 65%. As a result of these outcomes, more than half the total per-person annual cost of the Denver SIB was offset by cost avoidance in the other public services. Almost all of Denver's supportive housing costs were offset by reductions in the costs for other local services, like jail, ambulance services, court costs, and detox. Investors received their initial investment back and almost $1 million more than they contributed. The project was so successful, it passed the threshold in which investors also agreed to share success payments with providers, like Mental Health Center of Denver and Colorado Coalition for the Homeless. $251,000 of Northern Trust's portion of the $1 million in success payments will be shared with providers. I want to thank all of the program partners and investors for their contributions to the Denver SIB and our program evaluators for their work tracking the implementation and outcomes of this work. The program's results disrupt the false narrative that homelessness is an unsolvable problem and that people who experience chronic homelessness choose to live on the street. With the offer of housing first and the right supports in place, people can and did exit homelessness and remain housed and decrease their use of costly emergency services. More importantly, supportive housing dramatically improved the quality of life for more than 300 of the city's most vulnerable residents, and those impacts are immeasurable. That part of this story is best relayed to you by some of our participants. Here, in their own words, are their stories of life before and after securing supportive housing through the Denver SIB Initiative. Thank you.
I definitely come from a troubled life. You know, I came from a decent part of life, but my life had changed over the years. And I took a turn for the worst, which put me in a situation to where I was, you know, pretty much homeless. And I ran across this great organization, and these people, they did great things. Okay, they showed me that I was worthy of being saved. At a point in time where I didn't think anybody cared, they showed me they cared. And they took their time and effort to give me an opportunity to get in life. To where pretty much most people turn their own way. And they gave me an opportunity again. And each member, I haven't met a member there that doesn't have a good heart. And they go out of their way, I mean, to come and you know, check on me and see me. I was homeless. And in 2 weeks, I was given an opportunity to have my own place. And I have an opportunity to move back into society and get a job. And with that, there's so many other things that came, I cannot tell you. It is an abundance of things. I'm talking about, you know, just being able to go to a park or being able to go to a restaurant after getting a job, because I was jobless, homeless. So I did these things, all at the hands of the SIB's program.
Being part of the SIB project, to me, I came from on the streets, and I needed some help at the time, and so being part of the SIB project means that I'm still receiving the help that I'm getting, and that means, so I did my intake and all that, and then I met a couple other people, and then they put me in an apartment building downtown, and I really needed that at the time. I still need it now. Fortunately, I'm able to pay some money now, which is incredible. But you know, at the time, I was broke. I had no money. I had nowhere to go. I just finished a drug rehab, and they went ahead and put me up, and that was awesome. And then shortly thereafter, I got introduced to other people in the program, and this has happened consistently since I've been here. I've met all kinds of nice people in the program that come for different purposes, different jobs. But you know, like Sierra here, I see her once a week, and without fail, she's here every week, and it's awesome because I really look forward to it. You know, we even. Just recently, we played tennis last week, which was kind of fun. We got together and just for a couple minutes. It was, God, awful hot, but we played tennis, and it's nice to have someone to talk to and someone to help out like that. Prior to joining this project, I was homeless, and not in a very good place. I'd been homeless for a while. I hadn't been working quite some time, and I was really kind of lost. I'm still a little bit lost, but not near as bad as I used to be, and I have the program really to thank for that. More so even than the drug rehab that I went to. I mean, that helped out quite a bit, but I'd done that before, and I needed more than just a drug rehab. I needed some other things as well, and they didn't quabble over where I'd been before or anything. They just helped me out, took me where I was at, and helped me out. So I think I'm much better off now than I ever was. In fact, really than I've ever been, because I just finally got approved for my disability, which took quite some time. And now I feel like at least I can pay some money for some of the things that I'm receiving, which feels good. I feel like a member of society, at least, you know.
This program helped me not only with housing, it helped me in a lot of aspects as far as my mental health, my physical condition. It also helped me with employment. The reason I want to talk about this program because I'm real passionate about the issues and the problems that with the homeless people in Denver today. And I think this social impact program is one of the best programs I've ever seen. Not only was I able to be transitioned to permanent houses, I was able to meet medical needs. I got scoliosis. I was having a lot of troubles with my back, my legs, and I was staying in a shelter, and a major shelter was closing down, and I was uncertain where I was going. The social impact bond provided me transition housing at no cost. With that, I was able to build up my physical health and my spirits, and from there, I was given options for places to go. And I was surprised when I had a choice and I moved to Lakewood. I would never thought in my life that I'd be living in a suburban area coming out of homelessness. And I was just so grateful. And then as I started to realize that they are just more than just homeless, my case managers work with me to give me employment. My case managers work with me to address mental health issues. My mother passed last year. It really was a hard time, and it was a difficult time because if I was still on the street, I would have never been able to get on my feet. So my case managers was able to talk to me and refer me to different programs. I just believe that if people had compassion, like the social impact bond, I believe a lot more people in Denver would be off the streets, and I think this homeless problem can be conquered. I'm so grateful for everything that they did for me, and I really believe if people give them a chance and not look at their situations, they also can achieve this. I'm grateful, but I would like to see this extended to every person that's homeless, every person that got mental health problems, anybody that's addressing substance abuse or incarceration. I just thank God right now that this social impact bond program is available, and I just pray that it continue to be funded and be available because it's the greatest thing that ever happened in my life.
PJ, when he was born, wasn't eating very well. He was always in some level of distress physically, unfortunately with a failure to thrive. That was the diagnosis. It was when he got into high school, we started seeing some things that caused some concern.
They said, PJ, we need to get you checked out and looked at.
We were eventually able to determine that he was suffering from schizophrenia. And then eventually, as a matter of course, he became homeless.
I was sleeping under a bus stop. One time, somebody from Crisis Center grabbed me and said, man, you gotta stop doing this.
He used to feel like it would never get better. And then we would have conversations around what's going on with him at the time and how things could get better. It's time for him to move on. And then it was like, okay, but where does he move on to? Sanderson's goal is to address those individuals who have a history of homelessness. My son was one of those people for years.
Oh, come on in. Come on in.
One of the things PJ told me before he got to Sanderson was, when I get there, I'm not gonna mess it up. And you could see the smile on his face when he saw, okay, I'm going to probably be able to get that much better. And he always talks about how proud he is of where he's living, how he keeps his place. He is so proud of what he's accomplished. He wants to be a contributing person in society. He wants to be respected. He wants to be able to demonstrate that he's not the same person. And he works hard at that. The other people that live in this facility are part of his now new support system. Why he has made it, having to learn how to survive, get help when he needed it, family members being there, and then him finally learning it doesn't always have to be this hard. And I can probably do a lot better on my own once I know how to do those things. And he's learned that from an entire community.
They treat me with nothing but love, respect, and honor.
I want to thank Mayor Hancock for his remarks and thank each of the participants who shared their experiences with us in those videos. So powerful. I know we all appreciate the time and effort that went into making sure their voices could be a part of this event today. So thank you, thank you. I'm going to transition us to our panel next. But first, I want to take a moment to highlight some of the evaluation results the mayor just announced. So the results we're sharing today can be found in a few different reports published on our website, urban.org, and we'll share a link in the chat. All of these results are based on a 5-year randomized control trial that we conducted from 2016 to 2020. 724 people enrolled in the study in the first 2 years of the initiative, and we analyzed 3 years of data following each person's enrollment. About half of the study participants were in the treatment group, meaning they were referred to a SIB supportive housing provider at the Colorado Coalition for the Homeless or at the Mental Health Center of Denver. And about half were in the control group, meaning they received other services as usual that were available in the community. Because these results are from a rigorous experimental evaluation, we can be confident that any differences between these two groups are because of supportive housing. So there's a myth that people choose to be homeless. The Denver SIB results debunk this false narrative, showing that people can stay in housing even after living outside or in shelters for years, and all the while grappling with mental health and substance use challenges. Once SIB participants got housing, they stayed there. Of those who were housed through the program, after 3 years, 77% remained in housing. Supportive housing is a scarce resource, and not everyone who needs it has access to it. Over 3 years, people referred to the SIB received an average of 560 more days of permanent housing assistance per person than those who received usual services in the community. Denver SIB participants also spent significantly less time in shelters. Over 3 years, those referred to supportive housing had on average 40% reduction in total shelter visits and a 35% reduction in days with any shelter visits. So being poor and homeless is often criminalized in the US. People experiencing homelessness are more likely to interact with police and to face citations, arrests, and incarceration, often for nuisance crimes. The Denver SIB shows that supportive housing reduces interactions with the criminal justice system. Over 3 years, people referred to supportive housing had an average of a 34% reduction in police contacts and a 40% reduction in arrests. SIB participants also spent less time in jail. Over 3 years, participants referred to supportive housing had on average a 30% reduction in unique jail stays and 27% reduction in total jail stays. People experiencing chronic homelessness are more likely to have physical or mental health challenges and often use emergency services like detox facilities and emergency rooms to solve their health problems, instead of focusing on preventative and primary care. The Denver SIB Initiative broke this harmful pattern. Over 2 years, participants referred to supportive housing had on average a 40% decrease in emergency department visits. Over 3 years, participants referred to supportive housing also had a 65% reduction in the use of those detox facilities. At the same time, primary and preventative care increased. 155% increase in office-based healthcare visits for psychiatric diagnoses, and a 29% increase in unique prescription medications. Supportive housing is an intensive intervention that carries significant costs across local, state, and federal funding sources. But as the Denver SIB shows, supportive housing also helps people avoid costly outcomes, such as jail stays and emergency room visits. Denver SIB participants had almost $7,000 less total annually per person costs compared with the control group. The biggest avoidances were in reduced jail, ambulance, and emergency department costs. Approximately half of the total per person annual costs of the Denver SIB was offset by cost avoidances in other public services. So it really begs the question, what would it cost to scale the Denver SIB supportive housing program and realize the maximum cost benefit and also the maximum outcomes? Our analysis showed that to serve all 1,200 people experiencing chronic homelessness in Denver County would cost between $14.6 million and $18.7 million annually. But $8.3 million of that total cost would be offset by savings in emergency public services. So one of the unique aspects of the SIB was how it was funded. To fund part of the SIB, as the mayor noted, Denver leveraged $8.6 million in upfront financing from private investors, making the initiative one of the first supportive housing programs funded through a pay-for-success mechanism. This structure allowed Denver to shift the financial risk to investors and only pay if the program achieved positive outcomes. And it allowed some investors to make a return on their investment if certain outcomes were achieved. Because of the program's success, the city will repay the initial investment and more than $1 million more than the investors contributed. So to talk about the significance of these results, our panelists this afternoon represent many of the organizations and people behind the success of this Denver SIB. I'd like to invite all the panelists to turn your cameras on. I am honored to be joined by, give them a minute. Do we have everybody? Okay, let me start by introducing Dr. Carl Clark, who's the President and Chief Executive Officer of the Mental Health Center of Denver, one of the 2 SIB supportive housing providers. Margaret Danuser, who's the Deputy Chief Financial Officer of the City and County of Denver, the agency that spearheaded the Denver SIB on behalf of the city. And we also have Britta Fisher, the Chief Housing Officer for the City and County of Denver. Welcome. We have Deborah DeSantis, who's the President and Chief Executive Officer of the Corporation for Supportive Housing. CSH worked with the Enterprise Community Partners to serve as the intermediary for the SIB. We have Deborah Casemeyer, who is the Director of Community Development and Investment at Northern Trust, which was the lead investor for the SIB. Welcome. And John Pravinsky, who's the President and Chief Executive Officer at the Colorado Coalition for the Homeless, the second SIB provider. Thank you all for waving as I introduced you. That made it a little bit easier in this Zoom world. If you're interested in reading more about our speakers, remember that all their bios are available online. There's a link in the chat. So I'm going to start off the panel with a question for you, Margaret. The city and the council have been active champions and a leader for the Denver SIB since the very beginning, including advocating for and funding a rigorous evaluation. Tell me why the initiative was so important to Denver and what is the most compelling to you about the results 5 years later?
Thank you for having me. I think, the story of Denver Supportive Housing Social Impact Bond and how we got here today has to acknowledge the tremendous work by the entire SIB team here, as well as the advocates and innovators that came before me and my colleague, Britta Fisher. Stretching back to the data from the Denver's Crime Prevention and Control Commission, who identified the issue and put cost numbers to the jail to homelessness cycle, and Mayor Hancock, of course, who made the bold statement back in 2014 that we really needed to find a better way to break this jail to homelessness cycle through supportive housing and urged us to innovate with the SIB. Also, former CFO Carrie Kennedy and current CFO and my boss, Brendan Hanlon, who enthusiastically threw their support and more importantly, their money behind the SIB. The tireless support and advocacy from Tyler Jackal, who was formerly with the Harvard Government Performance Lab, who helped shepherd the program for several years and set up shop with us here in Denver's Department of Finance. And finally, all the data gurus and geeks from the Department of Safety and Denver Health, as well as many, many others. We wouldn't be here today without their foresight, support, and willingness to try something different through the supportive housing social impact bond process. But you asked me, why was the issue important to Denver? And why social impact bond model? As the mayor already stated, we know there's a real human cost in the jail to homelessness cycle. But what we were really trying to understand is to what degree supportive housing intervention might also impact the financial costs for these frequent users of emergency services. This really hadn't been proven out in a definitive manner yet. So in utilizing the social impact bond model, where we have strong service provider partners, this rigorous independent evaluation, and of course, our 8 private investors who put to work their capital up front. The city agreed to pay back these investors if they achieve certain housing stability and jail day reduction targets. So the city was actually paying for the desired performance outcomes that we were seeking. But the rigorousness of the Denver Supportive Housing Social Impact Bond study, both the process and the outcomes impacts analysis, really gave us a high degree of confidence that the program results would be real and also reflective of what was really occurring out there. Whether it proved out that the housing first cost avoidance theory was valid or not. And in fact, in 2018, because of the early impressive housing stability numbers we were seeing through the SIB reporting, the city actually stepped up and funded an additional 75 service slots with the Colorado Coalition. They're not included in this study here. This was outside the SIB, but it demonstrates the importance of SIB in providing actionable data that impacts policy decisions and programs, of course. As a finance person, this is probably the most compelling and encouraging thing to me about the SIB program results. It's that intersection of the data and how it can drive the policy decisions, that we can have a real impact on our community and people's lives. And due to the level of detail and richness of the data of this final SIB report, I know there are many ways the city and others can use this information and the pay for success model to enhance our existing programs and policies or craft new solutions to end homelessness.
I will say that, Margaret, along the way, it really warmed my heart as we were getting the positive results in the interim in the middle of this, and the city made that additional investment to continue to expand the program and make sure more people get housed. That's when the magic happens, when the data contributes to the expansion of housing for people. So Deb, my next question's for you. And we have a mountain of evidence that says that supportive housing ends homelessness, particularly on the housing front. Why is it important? What is important about the SIB results, and how do they add to what we know about supportive housing?
Yeah, thank you for that, Mary. And I want to start out by acknowledging my colleague, Katie Bottomaso, who was the project manager for the intermediary entity and our intermediary partner, Enterprise Community Partners. You couldn't, because I wasn't on camera at the time you were going through the results, you couldn't see the huge smile on my face, right? When you got to the point where you were talking about how, because this was a randomized controlled trial, we can say definitively that supportive housing made the difference in seeing the outcomes that we saw. And so let me say emphatically, these are exciting results, right? These are results that we haven't seen nationally. And I would say a couple things. One, this study went out further than other evaluations have in the past, right? So there are a number of communities throughout the country that have studied the efficacy of supportive housing, but typically they have only looked at a year and usually no more than 2 years. And this study went out, this evaluation went out beyond that. So now we have data that we can look at that shows us not just the results in year 1 of people being stably housed or the impact of supportive housing on recidivism rates, but we actually have results from years 2 and years 3. And that's really, really important. And so I would lift that up first and foremost. And I think as the mayor said so well, what this really showed us was that supportive housing produces lasting positive outcomes for both people and communities, and that's exciting. I would say, secondly, there are communities throughout the country that are grappling now with systemic racism and the overcriminalization and incarceration of people of color. And what the Denver SIB offers us is an alternative to incarceration, right? We see supportive housing as a real solution to reducing individuals' interactions with the justice system. And in fact, as you went on to explain, what we saw in the data was the sustained reductions. So not just 1 year, but right over time, we saw those sustained reductions in interactions with the justice system for the long term. So reductions in police contacts, arrests, jail days, occurred not just for participants when they first entered housing, but also 1, 2, 3 years out. And that's really important. I think it showed us that very skilled providers like the Colorado Coalition for the Homeless and the Mental Health Center of Denver can offer housing first with the right level of support. And I want to emphasize the right level of support, and those things can reduce the overall interactions with the justice system year over year. Finally, I want to just point out that I think what we also saw through the targeting criteria that was used for the SIB, that there were individuals that would have typically been kind of lost in the system because they didn't have interaction with the homeless system, right? But because this SIB was looking at the justice involved and looking across multiple systems, what we saw was a population with very complex needs, with histories of justice involvement that wouldn't have gotten picked up because they didn't have the history of homelessness that we see in some of the other studies nationally. So I think that's really important, that the two provider organizations use the data so strategically and the targeting so strategically to be able to find those individuals that would have normally got lost through the process.
Great. I think one of your comments about really thinking about alternatives to arrests and policing, that this study and this work that the providers did really helps us begin to start to reimagine what the streets may look like if we could provide more preventative care, more housing for people, and less policing. So I'm just as excited about the results as you are. And I will also say that it makes me so happy to say that it's important that this went on for 3 years, because this was a long study, and people were asking us for results along the way, and we're not very patient. And so it makes it all worth it. So to have those data for 3 years.
Yeah. Mary, just on the alternatives to incarceration point, too often housing gets left out of the conversation, right? And so what I think this does, it gives us the information to really say housing has to be part of the mix. And when housing is part of the mix, right, we can really show that people can not just reduce their interaction, but I think hopefully, and more importantly, avoid interaction, right? That we don't need to make the same investments in policing if we make them in housing.
Yeah, so true. So John, I'm going to turn to you next. One of the promising findings early in the evaluation was that most people referred to the SIB program were moving into housing at very high rates, and they were staying in housing. What do you think were the most important factors in your team's successful engagement of clients, both at the beginning of the referral process and over the years?
Well, Mary, one of the biggest myths surrounding homelessness is that people choose to become homeless and choose to remain homeless. And one of the earliest lessons of the SIB was to turn this myth on its head. Of the first 250 people who were referred to us for housing, referred to the program, only one said no to the appropriate offer of housing and wraparound services. Now, the secret was using assertive outreach. We have a very good street outreach team that connected with our social impact bond team, using assertive outreach and engagement strategies to make that work. And that starts by meeting people where they are, and meeting them and treating them with dignity and respect, because people don't always see that, and we heard that from some of the participants. It also builds trust that is so essential, particularly for people who have experienced trauma, as so many people who are homeless have, due to their prior mental health and health experiences. And recognizing that trauma, adapting interventions and engagement and approaches in light of that trauma, the essence of trauma-informed care, that's critical to that continued successful engagement for people. And then finally, it's really the commitment, the compassion, and the engagement of the staff who continue to work with people through their struggles and through their successes to make the program successful. It's not easy work. We don't want to make it seem like it can be done overnight and can be done by anyone. It really takes that commitment. It takes a skilled group of folks. It takes training, but really it takes, it's not work for the faint of heart, from the psychiatrists to the nurses to the case managers to the peer mentors. They all gave their hearts and soul to make this program a success. And if it weren't for that work that they did day in and out, we wouldn't be talking about this success today.
Yeah, I hear a lot of people asking the question these days, especially with all the federal resources for the stimulus and the emergency rental assistance. Can people move from the streets directly, from living on the streets or in shelter, right into housing? And the answer is yes, and your team has proved it. I think one of the things to highlight here is that people weren't showing up and asking for housing or for supportive services. Your team was going out and finding people and making that offer, and they were coming right in off the street. So this really shows and debunks that narrative, as you noted. So important. So Dr. Clark, MHCD developed Sanderson Apartments to provide additional supportive housing options for SIB participants. And I think, is that Sanderson right behind you? Maybe. So you developed Sanderson to provide additional supportive housing options for SIB participants, and you developed it specifically from a trauma-informed approach. In what ways do you think the housing provided at Sanderson supports resident success? And can you unmute your microphone? Sorry, we missed a lot of what you were saying while I was asking the question.
Okay, yes, this is
Sanderson. There you go. That's Sanderson, right?
Yeah, it is. And
Great.
John mentioned about the trauma that people experience when they don't have a place to live. And that's certainly true with all the participants that were referred to us. And to put it in perspective, this great process that was in place to really find people deeply in need was a good process. And the way it played out was we got pictures of people that the process picked, and we handed them to our case managers and said, go find them, right? And so there's a lot of outreach, and finding 60 people in 60 days was its own kind of challenge. So one of the things about trauma is that you can get re-triggered by even structures where you've been traumatized before. So we did talk to people about where their experiences was, and we wanted to create a place that did not re-traumatize people. It's actually a part of the influence of environment on our behavior. So all of us know that we are sort of different when we're in a museum or a church or an amusement park, right? So those structures themselves can influence how we feel. So the spaces are nice and open. What we heard was that it's really important to be able to see where people are. When you're on the streets for a long time, trusting others winds up getting damaged in a big way, and your sort of way of operating is to not trust people. And so being able to have wide hallways was really important for people to be able to feel like they knew where they were. Many bad things happened in stairwells for folks. So our stairwells are all glass, so people can see where they are and can see where other people are. Reconnecting with community, I think one of the things that we learned during the pandemic was that we are all deeply social beings. But if you've been on the streets for a long time and had this way of not trusting people, learning how to retrust and reconnect is important. So we have a lot of community spaces within the Sanderson apartments where people can gather together and be with one another. Now, the apartments themselves were designed with the idea that once somebody had an apartment, they may not want a case manager to actually come into their apartment. So the design was such that we can actually see the whole apartment from the door. So this is the front door here. You see the kitchen, the sitting area. You don't look into the bathroom from that door, but you do look into the bedroom. So this is sort of a picture of what a case manager would see when they come into the apartment. And then there, community spaces, nice and open. We got a lot of pushback on this because, big hallways cost more than small hallways. And we believe that it made a big difference in people's successes of being able to be there. One thing that's in one of the pictures, but just barely, is if you look at this second floor, in front of the doors is actually a different color that sort of wound up being people's porches. And people claimed them, and a part of the experience was, this is my space. So it gave them an ability to not only have their apartment, but to feel like, and this is my entry, and this is how I want to decorate it.
Thank you so much for showing those pictures. It's so helpful to have visuals. I think that when people think about supportive housing, that's probably not when most regular people think about it. That's not what they imagine. And it's really great to see such beautiful spaces and spaces that have meaning for people. So thank you for sharing those photos.
Yeah.
So Debbie, as the lead investor in the project, Northern Trust, what made the Denver SIB a compelling opportunity for you in the beginning, and did it achieve the goals that you wanted to set as an investor?
Yeah, so we're always looking for opportunities to deploy capital to create long-term sustainable change. And so in this particular case, we had providers who had proven that they could do this, that they could house chronically homeless people successfully. And we had the city that had a desire to create better outcomes for the citizens of the city of Denver and better outcomes for people experiencing homelessness. But there was a disconnect in terms of the city wanting to make sure that they were getting the outcomes that they wanted, and then the providers needing the capital to be able to do those wraparound social support services. So as investors, we are the connector between those two. So one of the things that we focused on, first of all, was with the providers. Yes, the providers were successful in delivering this, but when you think about how they had to go about funding that, so I don't know how many funding streams John has to put together to be able to provide services. In this case, the idea behind the social impact bond is that we front fund what it costs for them to provide these services. So John doesn't have to run around and try to figure all this out. He only has to focus on providing the services to the individuals in order to keep them housed. That's really important and a key part of this. So we also wanted to make sure that that front funding was flexible, that we gave the providers the ability to do what they needed to do and not have to worry about any reporting back or any of the budgets or any of that sort of thing that they might have with other funding sources. This was supposed to be unique and different. So we did that, and obviously they did really well with that. Like they took that and they ran with it, and they showed what they can do when they have the right kind of funding up front. And then from the city side, what we were able to do was take away the risk from the city. So as you said, Mary, they only pay the investors back if the outcomes are actually delivered. So that meant that that risk and mitigation was then transferred to the investors. And we were then charged with underwriting the transaction and making sure that the transaction was structured so that there were mitigants and other things that we could control the risk, so that we could look at sort of the business side of that and make sure that that was going to work from an investor standpoint. And then the city then is only paying for what is actually delivered from success metrics. So it really is sort of the best of both worlds, where you have people that are willing to pay and you have great service providers, and then there's just this link in between the two to sort of make it all come together. And I do have to second what you said before, for the city to go and do that second funding, to me was like, that is success. So when you say, was this successful? Absolutely, because that's what we're trying to get to. We really are trying to get to funding streams for successful nonprofits that can deliver. We know they can deliver. And so to being able to prove that, and for them to be considered as like vendors in essence, or business partners, so that they're not so reliant on grant dollars, but actually looked at as partners, is really the goal here.
Great. And I know all the investors all along the way were paying attention, we're looking at data. And as you noted, the grantees weren't really reporting data out to the investors. We actually, as the evaluators, were reporting data back to the investors, and then also reporting data back to the service providers, and using that data along the way, I think, to inform the program implementation, which I think was really helpful as well. So it was great to have everyone kind of collectively around the table. So I'm going to come back to you, Deb. I know a lot of people are joining the event today from other communities, and they're thinking about how can they replicate the results of the Denver SIB. What do you think are the key lessons from the implementation of this supportive housing initiative?
Yeah, great question. And I want to key off of something that Debbie just said, right? She talked about how we knew that these were experienced providers. So I think it's important to note that the SIB was designed to scale supportive housing. And so from the beginning, it wasn't about testing out something completely new, right? We went into this with the assumption that supportive housing works, and there's some things that we can learn by scaling it. And so it worked again because these two providers, I think, are so sophisticated, right? I think it also worked really well, and I think it's important for other communities to take note about the partnership and the collaboration between the public-private sector and the nonprofit providers. This is a group that met fairly regularly, reviewed the data, looked at the results, and I think most importantly, had the opportunity to course correct when necessary, because we were all looking at real-time information, right? And using that information to inform different programmatic things throughout the process. So that partnership, I think, was key throughout. And I think what we also learned, and I'm glad that we were able to learn this, and we can now say this, that supportive housing can be effectively scaled, right? That's what the SIB showed us. It really was the mechanism to scaling the intervention that we knew could work. And in this case, I think the emphasis on those who had justice involvement was really important, right? So this gave us a roadmap for how we look across different systems, including the justice system. And I think a lot of the work that the two providers did to do that reach into the justice system was really important, and should really be noted as part of the success to the SIB. I think so, the fact that the SIB was a catalyst, right? I'm sure there are communities that say, why do we need the SIB, right? Why do we need investors? Why isn't government doing this? Why do we need this, somewhat complex, maybe complicated structure to achieve these outcomes? And I would say that the reason is that government still doesn't have a lot of flexibility, right? And so having the public sector come together and be part of the structure, I think was catalytic. And it really incentivized government to look at the outcomes that they were paying for in a very different way, which I think was really important. And if I can say, I think it also helped the providers to look at the outcomes differently as well. And that's what we would want in any community considering a SIB structure or a pay for success structure, to really put the emphasis on what are the outcomes that we want to achieve, and putting the structure in place to really track those outcomes. But the SIB, I would say, was the catalyst to being able to incentivize that $8.6 million investment into service funding, and to scale what we knew was an effective intervention. And so now what we have is that roadmap, right? So Debbie talked about how, how great it is that the city now has made the commitment to scale this even further. And they're able to do that because they have the structure, they have the funding and service model that they can now replicate, that was created because of the SIB initiative.
And the city during the SIB time moved from the sort of pay for success mechanism to an outcomes-based contract. So that was another big, I think, outcome from this, which is, to really move to outcomes-based contracting for services and, paying for outcomes instead of process, which is a really great outcome as well of the SIB.
Absolutely.
So John, in the evaluation, we saw how difficult it was for people receiving services as usual to access permanent housing assistance, very scarce in most communities across the US, particularly in Denver as well. And in the cost analysis, we looked at the cost of scaling SIB, supportive housing model. What do you see as the biggest barriers to increasing access to supportive housing, and what might the solutions be?
Well, Mary, probably one of the most challenging part of releasing this report today is that while it reinforces what we've known for more than 20 years, that housing first works, that supportive housing with wraparound services works, that integrated healthcare provided and linked to housing works, we haven't been able to do it to the level, to the scale necessary to meet the growing need that we're seeing here in the city of Denver, and we see in other communities across the country. And when you tell somebody living across the street from an encampment that's growing daily day by day, that the SIB program is a great success, they're likely to ask, well, why are there still so many people on the streets? So ultimately, the answer does come up to the need to scale up programs like the SIB to the level that is commensurate with the needs that we have in our communities. And that means building more, investing more in building supportive housing, increasing rental assistance for people who can't pay for housing on their own, enhancing the health and the mental health treatments and other supports that are so critical to help people obtain and maintain that housing. And so through programs like this, we housed 363 people and kept the vast majority of them housed at least for 3 years. And yet tonight, there's still 1,000 people on the streets of Denver, despite an increase in other city investment, and another 2,000 in our emergency shelter system. So that means that we need to expand programs like this by 8 times just to meet the needs of the people who are homeless tonight. And then we need to have a robust system of connecting people who become homeless in the future to similar programs or to other emergency responses. If we can do that, then we will indeed end homelessness here in Denver, and other cities can do the same.
Yeah. I think it is important, as you said, to note that we've known for a long time that supportive housing works, and that we know the solutions to homelessness. We just have to implement them. And that just takes a lot. That takes scaling, takes funding. It also takes political will, and building that system that really works. So it's a lot of work ahead. There's 1,200 people still chronically homeless on the streets of Denver. So I'm going to turn next to Debbie, back to Debbie. The Denver SIB was one of the first supportive housing social impact bonds when it launched in 2016. How has the SIB informed your ongoing investment strategies?
Yeah, so I would say, so I think now we've done 8 social impact bonds, and they've all been a little bit different. And the one thing that we've always learned is that you don't know what you don't know. And that is always true when you get into something like a social impact bond. I think the other thing is that there are very dedicated, smart people in the social service world that have done a lot of work and do have answers to some of our toughest, wickedest problems. And they need capital, but they need the right kind of capital to be able to scale those solutions. And so a transaction like a Pay for Success, where you're bringing different partners together, so that public-private partnership, and then adding in these really smart social service providers, I think is key. And so not only just in the homeless space, but some of the other issue areas that we work in, really taking some of these learnings of how we can all work together and bring what we all do best, and then build on that to really get to scale and really deliver some long-term sustainable change to these really difficult issues.
Great. Dr. Clark, my next question is for you. In the analysis of healthcare outcomes, we found a significant increase in office-based care and a decrease in emergency department visits. One of the messages we think this evidence supports is that housing first is not housing only. So what do you think are some of the most important aspects of the SIB service model that led to the improved health care and other outcomes?
Yeah, well, so first of all, the social impact bond actually paid for the wraparound services that needed to happen. And, without that funding, even it's impossible to put that wraparound there. So, and the success, I think, is a couple of things. I think this Housing First is a great example of how social determinants of health have a bigger impact on people's overall health care than anything else. So it's housing, it's working, it's going to school, all of those things. And we use that as the connection with the folks that we housed. So the treatment approach was really looking at what do we need to work on to help you be successful in this housing. So early on, a lot of it was about connecting with other members in that community, and learning to have trust. And one of the things that we found out for folks, and this is a group of folks that had been without housing for a long time, is they're sharing with us that people had given up on them. They had no expectations of them, like they didn't matter anymore. And a part of getting this apartment was a step towards somebody actually believes I can do something again. And then working on what are the things that need to be addressed to help you be successful in this housing. And it might be treating your trauma with substances. I know you're trying to feel better, but it's not really going that well. And then engaging people in other options rather than misuse of substances. And then certainly there are people both from their trauma and their experiences who were experiencing mental health issues too. And so treating people's depression or bipolar disorder or whatever it might be on their own journey about, I want to be successful. Now, a very interesting thing is there were a portion of these folks that had been homeless for a long time that had jobs, and yet they were homeless. And we know that for many people, actually getting a job was important to them. And when you're going to get a job, it's important that you address issues that might get in the way of that too. So like one person told me, it's like, you know, if I'm psychotic in my apartment by myself, honestly, it's not that big of a deal. But if I'm psychotic while I'm trying to do my job, it really gets in the way, you know? And so that sort of self-worth and connectedness and being on their journey about what they want to do was a big part. And then John pointed this out earlier, is that it's not necessarily easy work. One of my staff members described, well, you know, some of the folks that we have here are kind of spicy, which means they might have a way of interacting in the world that's kind of, you know, difficult. And then helping them be able to move and interact in a different way and not giving up on them, I think was a very big part of this. I will say that the community where we built these were not necessarily happy about our having folks that had been, you know, experiencing homelessness for a long time in their neighborhood. But eventually, through community meetings and meeting with the neighborhood associations, they moved from, we don't want those people here, to these people are a part of our community.
Yeah, that's great. It's so amazing to move from this sort of othering of people who they see as set apart, and then really of thinking of what people are, which is our neighbors in our community. So that's fantastic. And I know there was some challenges early on with community engagement, but that over time that it did improve, which is great. And I also love the slogan, housing is health, or housing is healthcare. It's so true that having that foundation and that stability is so important before you can work on those other issues. So having housing first is really critical. So I'm going to turn to Britta. Part of the city's big bet was making, that they were making when they entered into the social impact bond agreement, was that supportive housing would help shift resources from expensive emergency services to permanent affordable housing and supportive services that yield better outcomes for residents. So how do you think the initiative's impressive results will inform Denver's policy and budget decisions going forward? These are some really long questions.
I got it, Mary. Thanks for that question with all its nuances.
Yeah.
I'll try to cover several of those in my answer. But first, I want to acknowledge that the man who publicly made that bet was Mayor Michael B. Hancock. And, you know, it took something to stand up and do that. And he's seen those results along with all of us now. And it's really wonderful to see these impressive results. Margaret already mentioned that, you know, we did continue to do investment in extending 75 additional service spots in 2018. Well, that's not the only investment that we've continued to do. Of course, we've recently extended the contracts to continue providing this units supported through this program through this year. So we're continuing to support people currently in this housing. And we also are building more. We have 4 projects right now that are supportive housing projects and under construction, with 254 affordable homes that will be supportive housing here in the Denver community, including one of the projects that is being done by Colorado Coalition for the Homeless, Legacy Lofts. And, you know, we're working every day on resolving homelessness. You mentioned the costs of managing homelessness, and the pandemic gave us a whole bunch of new numbers about how expensive it really is to manage homelessness. And resolving homelessness is better overall for everyone involved and for our community. Well, some of the strategies that we have employed over the years are things that we want to continue pursuing. One is one that was pioneered again by the Colorado Coalition for the Homeless, and that was taking a motel and turning it into housing, or as I like to call it, practically instant housing. It's already the infrastructure there. It needs just a little bit of work and it becomes housing. And so we've announced here in Denver that we are intending to purchase another hotel to turn into housing, much like that Fusion Studios project done by the Colorado Coalition for the Homeless. And we want to do more. We have a lot of needs right now. And one of, I think, the hard things about the scale that John mentioned that we need to address is that it's timely right this moment, but this type of process to finance, build, and then move people in can take a long time. So we are innovating as well on that concept. And then finally, I just have a lot of gratitude for our Denver voters who have also seen these early signposts of success. And in 2020, they voted into being a measure called 2B, which created the Homelessness Resolution Fund. And this is now a source of funds that we have to create more supportive housing. That was the cornerstone and the foundation of that campaign. And now my department, the Department of Housing Stability, and the whole city and our partners will be delivering upon that. And we're very excited to bring more supportive housing to Denver.
That's great. We're excited too. So I am with that going to open up to our Q&A. We have some questions coming in from our audience. And I'm going to start actually with thinking about with that eye on the future. And this is a question for anyone who wants to answer it. What can federal legislation and policy do to promote more housing programs informed by the success of the SIB initiative? Does anyone want to take a crack at that first?
I'd be happy to take a crack. You know, we just need more scale, right? We have proven this works. And when we talk about the constraints that we face, there's many, but a couple of the big ones where the federal government could be a big help are one, vouchers. The Biden administration has announced that they are supportive of universal vouchers, which would take what can currently feel like game show odds of a chance for a lottery to get housing to really saying everyone who qualifies could get housing in their community. That would be game changing. But we also do need to still build those places that will accept the vouchers and also work to make the existing stock accepting of those vouchers as well. And so we need more tax credits. Let's go ahead and get those doubled, tripled, quadrupled. We have those types of needs in our communities across this country. I chair the High Cost Cities Housing Forum, and we're just one of 9 cities in that forum that are seeing these types of demands and scale of need in our community.
John, were you going to unmic as well? And I know, Deb, you want to get in there too. I got you both in the queue.
Yeah, the other leg of the 3-legged stool, you know, the rental assistance, the money to build the affordable housing that can link to that. And of course, the third is the services, the support services, the integrated health, mental health, and others, housing supports that are so critical. Because we learned also through other studies that just giving someone a key to an apartment and walking away saying goodbye, that is not necessarily going to be successful for everyone. So if we can do all 3 of those things and do it to scale, we will make a difference.
I'm going to go to Deb.
Mary, can I add one more really specific program? The city applied for a CIPRA award back in 2019. This is the Social Impact Partnerships to Pay for Results Act. And we were taking some of the early successes of SIB and expanding it for additional housing units, but also to look at some of the healthcare savings that we've seen in the report, but really did not measure cost savings that could accrue to the federal government. And so we are very hopeful that we are getting very close to a CIPRA award and hope that starts moving soon too.
Great. Deb, do you want to get in there? And Dr. Clark, I have you up next.
Yeah.
If you want to chime in.
So I, much like Britta, I was going to acknowledge the opportunity that we have now with the federal investment in housing vouchers, but just wanted to just make the pitch for advocating for set-asides of project-based vouchers. from the federal government. It's exciting to think about the number of vouchers that communities might receive, but without the project basing ability, we're not going to be able to kind of continue to fuel the pipeline of units that we need. And then I was going to piggyback on what John said. You know, Mary, one of your comments was housing first doesn't mean housing only. And I think we saw that through the SIB initiative, right? That it was successful in large part because of the array of services that these two providers made available to the residents of supportive housing. So without the services linked to the housing, we're not going to be able to successfully transition people from the streets or from institutional settings. And we certainly aren't going to be able to keep them in housing. So the services is really important.
Anyone else want to address that question?
Sure. I would say that at the federal level, what we need is a change in mindset. Right now, we live in a country that doesn't believe everybody deserves a place to live. And if we believe that everybody deserved a place to live, I think it would move us forward.
Excellent point. Absolutely. I think that is absolutely true, Dr. Clark. So we have another question from the audience about how other government agencies were engaged in the SIB project. So like healthcare agencies, the police department, and how the city and the SIB partners built buy-in with these departments. So maybe this is John and Dr. Clark talking a little bit about how the service providers really worked with the other agencies.
Yes, so the rollout of the SIB, initially funded the robust service package that was so critical, and some housing vouchers to be able to leverage. But we really needed to leverage the other mechanisms to build affordable housing. So MHCD, was able to build Sanderson apartments utilizing traditional tools of the low-income housing tax credit program. We were able to build the downtown lofts, bridging both traditional low-income housing tax credits and private activity bonds to get to 100 units. So all of the support of those institutions that are supporting just building affordable housing were critical to make that happen. Then once we got people into housing, of course, we needed to interface with our emergency rooms, with our police departments, in order to address that, the impact of transition. And through that, we actually have, Margaret talks about the CIPRA and the promising results of being able to really move the needle in reducing avoidable emergency health care. And the study shows that that's happening. But we do think that with the CIPRA and with other initiatives with our hospitals, the inreach that we've been doing, the transitions of care, building recuperative care, medical respite, and other things, those systems working together can have a profoundly even greater impact, not only on the individual lives, but on the quality of life of the entire community, and save costs at the same time.
John, I would say well said. And there were some surprises too, right? So this is a group of people that were interacting with the criminal justice system pretty regularly, but they were doing that all over the city. And when they all came to like one spot, right, like Sanderson Apartments, now they were interacting with the criminal justice system in one police district. And I don't think anybody anticipated that in the beginning. And so the resources for that police district had to catch up, right? Because they were getting, calls, people were, used to panhandling, they were still panhandling. I mean, there were a whole variety of things that happened, and we did not sort of think about that ahead of time. So I would highly recommend anybody doing these projects to learn from our lessons, right? That there are other types of interfaces that are going to occur. One of the things that we do have in Denver is we've looked at every aspect of where someone that's dealing with a mental health issue or a substance use disorder, where they interface with the criminal justice system. And we actually have interventions at every point. So that's from on the street police officers to if somebody goes to jail, if they're being arraigned in court, all of those places we have ways to help people disconnect from the criminal justice system and get into treatment services.
Okay, I'm going to keep moving because we have a lot of questions coming in. So we received several questions about what it might take to make some of the estimated cost offsets real savings for the city. In our cost analysis, we talk about the importance of scaling to realize maximum cost benefit. So Margaret and Britta, how are you thinking about these cost offsets, and what impact do they have on city budgets?
You want me to start, Britta? Okay. So the SIB cost study results certainly demonstrate the cost avoidance for the city from the program. That is, without the Housing First SIB intervention, the city would have had to pay the cost for the emergency services for this individual or these individuals. We might have had to hire more people or extend hours, et cetera, to serve the additional need. But due to the results we saw and early success in SIB, we've already mentioned that we expanded SIB time slots because we were realizing and seeing strong housing stability, and by extension, the cost avoidance by use of emergency services that we thought gave us the room and the leave to expand that. Also, as already mentioned, while we were waiting for these results, the cost study was one of the last things to come in, and we were eagerly awaiting the results, but also, as Britta mentioned, extended the performance contracts for 2021, just so that we could keep the momentum moving and decide next steps. Britta, what else do you have to add?
I think I would just add a couple things. One, we talk about in housing often the economic impacts of both building and rehabilitating units. And right now in economic recovery, that's part of the story, right? That with every unit, our home builders and several of our nonprofit affordable housing groups have shown through study that every unit that is renovated or built supports 2 local jobs in our community. These cost avoidance numbers also help to show what the ongoing benefit of that housing is, not just at construction, but that support services, the stability of the housing provides a lot of benefit to our community and to our taxpayers. The state also has some very compelling numbers on that. I think the last thing that I would just add on that is that as we look at budgets and we look at how we're spending money, it is important for us to talk about what we're already paying and the cost that it has in these emergency services and the cost that it has on humans and that toll that was spoken about before, and how this is such a better investment. This is why Britta's always talking about housing, is because that is really, at the end of the day, the foundation of what's going to have solutions in our community.
Okay, I'm going to go for the last question actually to Debbie. We received a question about how the Denver SIB attracted investors in this opportunity. So can you talk more about what you look for and how you find your social impact bond investment opportunities? They want to know your secrets, Debbie.
Yeah. So anyone that's in this space knows there's a lot of buzz about impact investing. I use air quotes. So there's a lot of capital out there that say they want to invest in impacts. So really the key is to provide them with a vehicle that does that. And so that's why social impact bonds do actually fit that bill. I think for Denver specifically, we were blessed to have Social Impact Solutions and Mary Wickersham and Ken Weil put together a really complete financial model. So it was, they really looked at all of the different variables. So it was very easy for investors to look at that and determine whether or not they felt they were going to get their principal back, and then make that investment. Because they knew I think they had a good idea of what the impacts were going to be, because like I said before, like the service providers had successfully done this in the past. So it was really trying to balance those two things. And I think that that's sort of the key thing, is making sure that you have something that's easily digestible so that the investors can look at it, it fits into something that they're used to seeing, and that your investors are also aligned, that they're really trying to get to the same place. This is not a money-making opportunity. We're not trying to do wealth extraction here. We really are trying to use capital and leave more capital in the community than we have taken out. So you definitely have to find the right investors, but there are lots out there. So the other investors that are with us in the SIB, a lot are foundations, nonprofits, are primarily who make up the other investors in this, and they are all already funding in a wide variety of ways, homeless services and the two providers that are here. So this was just another addition to them for them to expand how they themselves invest. And I think that's similar in all communities. So I think these investors are already there. It's just really honestly finding payers, government payers, hospital payers, whoever it wants to be on the other side of this that's willing to pay. The investor part, typically a lot of times people will talk about the investors first, when really the most important things are who's going to pay for this, and then who are the social service providers. If you can get those two things, and then you can get the financial transaction modeled out, the investors will come.
Great. Okay, I'm going to give all the panelists one last final word. Before I do that, though, and you're going to have probably 30 seconds, we're running out of time, but I'm going to give you time to think about that. Before I do that and open it up to you, I want to thank all the people at the Urban Institute that are on the research team and the communications team. I get to stand up here, but there is a big team of folks who made this happen, who made the study happen, and who made the event happen. So I want to thank Mike Pergament, Devlin Hansen, Sarah Gillespie, Elise Oneto, Patrick Sposter, Ivy Hunter, Amy Pfeiffer, Megan Ashford Grooms, Dan Fowler, Joella Carmen, Elizabeth Forney, and so many others at the Urban Institute. Thank you. So thank you all, the panelists today. I'm going to go, I think, let me see, I have an order here. We're going to start with Debbie, and then we're going to move to Deb, Dr. Clark, John, Margaret, and Britta. And just try to stick to 30 seconds.
Got it. So I would just like to say we are just very thankful to have been included in this transaction. It has been just a wonderful experience for us to work with everyone, to get to know everyone. And the other thing I would say is that this transaction has led to many, many, many more investments in the city of Denver. And we are really, really happy about that.
Great.
Yeah, I want to express our thanks to the partners and to the city, to the mayor, for making this huge leap of faith and putting in the time and effort to demonstrate that it could work, and to Urban for being part of the journey. And just for anyone who might have doubted the impact of SIB or the efficacy of supportive housing, I would just say, remember the smile on PJ. I think that says it all right there.
Dr. Clark.
Yeah, what makes us uniquely human is our imagination. And we imagined something that didn't exist before. And I can't imagine another group I'd rather do it with.
Thank you. John?
I've been doing this work 35 years here in Denver. And first of all, having the finance department take the lead in terms of making this investment happen, that was unique and it was transformative. And then in that process, the creation of the Department of Hosts that brought Britta into that leadership role has really given me hope that we can make a difference. But just like the Academy Awards, I'm just a spokesperson. The people that made this happen at the coalition, Lisa Thompson and Carrie Craig, and all of the SIB team leaders, again, the providers, the counselors, the peers, the outreach workers, and the maintenance workers who had to go into some pretty dicey situations to help prevent evictions. So those are the folks who really make this thing work. And I'm just so pleased that they're with us and that they continue to work with us.
Great. And Margaret and Britta, we're at time, so no pressure.
I just say, as a finance person, it was great to stretch our wings a little bit. I'll kick it to Britta.
And just a thank you to everyone. We know what works. We can do this together. And it's great to have been working with all of you on this project.
Thanks to all of you. Just a reminder that today's event will be posted online. There's also a ton more to read on urban.org if you'd like to read any of the reports published today. Please take 1 minute to fill out the event survey in the chat. And just thanks to everyone again. It's been a real honor to be a part of this work. And I'm looking forward to seeing what comes next. Thank you for joining us.